Hi Terry, my name is Alice. I'm the nurse at the GP clinic. What have you come in for today?
I've come in for a heart wellness check.
Okay, and I've got that here as well. Before we go any further, is it okay if I identify some of your information?
Of course, no problem.
Okay, could you tell me your full name and your date of birth?
Terence Graham James, 19th of August 1939.
So Terry, the first thing we're going to do is to ask a few questions about risk factors, okay?
Yes.
So do you know if you have any diabetes?
No.
No.
None whatsoever.
Okay, and how about high blood pressure?
I do have high blood pressure, but it seems to be under control.
Okay. And what's your normal level of physical activity?
I do yoga every morning, about half an hour. I walk. I'm active around the house.
That's really
I'm
good.
not a sedentary person. I like to keep moving.
Perfect. That's really good. And do you smoke?
No.
No. Good.
Anti.
Good. Anti-smoking. That's good. And do you know if you have high cholesterol levels?
And not that I'm aware of.
No. Good. And any past medical history in general?
You mean in the family?
And yourself?
In myself, I do have AF,
Okay.
which is atrial fibrillation, which comes and goes, but doesn't seem to be present at the present moment.
Okay. I'll ask you a few questions about the AF a little bit later. Is that okay?
Yes, of course.
Okay. And how about in your family? Is there any history of
In the
medical issues?
family, my father had heart problems,
Right.
and that seems to be the only thing that I'm aware of.
Okay. And you don't remember what sort of problems they were?
No, I don't.
Okay. That's good. And then a few questions just focused on your heart function, okay?
Yes.
Do you have any chest pain or any tightness in that area?
No.
No. Okay. And do you get any shortness of breath?
No.
Nope. When you go to sleep at night time, how many pillows do you use to go to bed?
There's always 3, but I generally sleep on 1, so...
One, and that's fine for you? You don't get short of breath?
No.
Okay, good. And do you have a cough?
No.
No. Good. And do you get tired quite easily?
If I've been quite physical during the day, yes, I am tired, but no, not otherwise.
Okay, that sounds quite normal, so that's good. And sometimes do you notice a change in your skin color? Like, does it go a little bit blue or a little bit grey?
No, not that I'm aware of.
That's really good. And how about any swelling in your feet or around your legs area?
No, I seem to be all right. I've
right.
never noticed swollen ankles. No.
Okay, good. And at night time, do you find yourself waking up to go to a toilet quite frequently?
Yes, probably about 3 or 4 times during the night.
Right.
But I generally go back to sleep afterwards.
Okay. And how long have you had that for?
About 4 or 5 years.
Quite long term then. Is that normal for you?
I consider it normal. I don't know whether it is.
Okay. Well, I've noted that down. And I know you've told me about AF as your past medical history and a little bit of a high blood pressure. Is that right?
Yes.
I'll just ask you a few questions specific to that. So when you have your AF, how does that feel?
I feel it doesn't hurt, but I don't feel comfortable
Right.
around this area here. So,
Okay.
And then I take my pulse and to find out whether it's normal or whether it's in rhythm or not.
And sometimes when it comes on, do you sort of expect it, or does it just come on its own?
It just seems to come on its own.
Okay. And when were you diagnosed with it? Sorry.
About 6 years ago.
6 years ago. Okay. And so you've had it for these past 6 years then, I believe.
Yes.
Okay.
Yes.
And how severe is it? Does it limit you in what you do during your day-to-day life, or?
No, because I don't actually worry about it if I can help it.
Okay, good.
I know that it's there, and I just try and get on with it.
Very good. And are there things that make it better or things that make it worse?
If I can relax and breathe deeply, it seems to control it.
That's really good. And I believe you're on some medications for it, and I've got them here. Is that right?
Yes.
Okay.
Yes.
And would you say it's well managed right now?
I would agree wholeheartedly. Yes.
Okay, good. So I've asked you all the questions I need to ask you. The next thing we're going to do is to get you onto the bed and we can do a physical assessment of your heart, okay?
Okay.
Is that
yes.
all right with you?
That's perfectly all right.
Perfect. Okay, Terry. So the first thing that we're going to do is I'm going to have a look at your body, okay? And so from the top to the bottom, I'm going to get you to look towards your left, and I'm going to look for the veins in your neck, okay?
Yes.
Okay, they look normal to me. That's fine. Okay, and then the other side as well. Perfect. Okay, Terry. The next thing we're going to do is to have a look at your limbs, okay? So we'll start with your arms. Could I get you to open up your arms like that? Perfect. And then the other way. Perfect. I notice you have a bit of like a swelling or a little bit of a mass. Could you tell me a little bit more about that?
Yes, it's a lipoma. I've had them for 50, 60 years.
Right.
And they're over my body.
Okay.
They don't hurt.
Okay.
And I don't do anything about them.
Okay, so no issues with them.
No.
Okay, good. I'll have a look at your feet now, okay, and your
Yes.
legs. All right. Okay, so we'll get you to straighten your legs a little bit. Perfect. Okay, Terry, that looks normal to me. The next thing we're going to do is to have a feel of your pulses. And so there's 2 on your neck area, and then I'm going to feel them in your arms and then near your wrist, and then some in your legs as well. Is that okay?
Yeah.
Okay. If I could get you to look up for me. Okay. Good. 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 Nice strong pulses. Okay. So I'm gonna feel for this one a little bit longer, just to check we don't have any atrial fibrillation happening right now.
Okay.
Perfect, that's normal. And then just towards your feet, okay? Okay, that's fine. And that's fine as well. And that's perfect. If I could come back to your fingers and your toenails, I'm just gonna press on your fingertips, okay? And I'm just looking at how fast the blood comes back.
Okay.
Okay, on both sides. All right. That's fine. And I'm just gonna lift this hand up to eye level, okay? Good, and the other one as well. That's perfect. And then I'm just gonna press on your toenails as well, okay? Awesome, that's fine. And the next thing we're going to do is we're going to have a look at your chest area now, specifically at the heart, okay? Is it okay if I take off your t-shirt and I'll grab you something so you can put on your top, okay? Okay, Terry, the next thing we're going to do is exactly the same as what we've just done. Now I'm going to have a look at your chest and then have a feel of it and then have a listen to it a little bit later on, okay?
Okay.
So I'm just going to have a look now. Good, nothing abnormal that I'm finding right now. When I'm going to have a feel now, I'm just going to feel the spaces so I know where to listen to when I listen, okay?
Okay.
And then I'm also going to put the palm of my hand onto certain areas of your chest. If you ever feel any pain or discomfort, let me know and we'll stop, okay?
Okay. Yeah.
Okay. Quite normal. That's fine. I don't feel any abnormal movements. So now we're going to have a listen to your heart now, okay? Don't be alarmed if I listen for a little bit longer than necessary.
Okay.
That's fine. I'm just going to have a feel once more, okay? And that's fine as well. So this comes to the end of our assessment. All my findings are normal. Do you have any questions for me, Terry?
Not that I know of. You've
No?
answered the ones that I wanted to know about, so
Perfect. I'll take this off you and I'll give your clothes back to you, okay? Thank you for your time.
you're most welcome. It's been most enjoyable.